Question 1. A patient with schizophrenia tells the nurse, "The voices are telling me to hurt myself." What is the nurse's priority action? A. Ask the patient why the voices are saying that. B. Administer prescribed antipsychotics immediately. C. Implement suicide precautions and notify the provider. D. Tell the patient the voices are not real. Answer: C. Implement suicide precautions and notify the provider. Rationale: this is a psychiatric emergency. Command hallucinations can lead to self-harm or suicide. Ensuring safety and notifying the provider are priority. The other options fail to address the imminent danger. Question 2. A nurse observes a patient with schizophrenia sitting alone, laughing and speaking to no one. What should the nurse do first? A. Document the observation. B. Ask the patient if they are hearing voices. C. Ignore the behavior as it's not disruptive. D. Increase the dose of medication. Answer: B. Ask the patient if they are hearing voices. Rationale: assessing for auditory hallucinations is the first step. This guides further interventions and ensures safety. Ignoring or documenting without assessment is inadequate. Question 3. Which of the following symptoms is considered a negative symptom of schizophrenia? A. Hallucinations. B. Delusions. C. Anhedonia. D. Paranoia. Answer: C. Anhedonia. Rationale: anhedonia, inability to feel pleasure, is a negative symptom. Positive symptoms include hallucinations, delusions, and paranoia. Question 4. A patient with schizophrenia reports ants crawling under my skin. What type of symptom is this? A. Visual hallucination. B. Delusion reference. C. Tactile hallucination. D. Paranoid ideation. Answer: C. Tactile hallucination. Rationale: feeling things that aren't there is a tactile hallucination, a common positive symptom. It is not a delusion or visual hallucination. Question 5. A patient with schizophrenia is pacing and clenching fists. What is the nurse's best first action? A. Call security for restraint. B. Offer PRN antipsychotic medication. C. Use a calm tone and ask what is upsetting them. D. Leave the patient alone to calm down. Answer: C. Use a calm tone and ask what is upsetting them. Rationale: de-escalation using therapeutic communication is the safest first step. PRNs may follow if needed. Restraints are a last resort. Question 6. A patient with schizophrenia is taking haloperidol and develops muscle rigidity, fever, and confusion. What should the nurse do first? A. Reassure the patient. B. Give antipyretics. C. Stop the medication and notify the provider. D. Administer more haloperidol. Answer: C. Stop the medication and notify the provider. Rationale: these are signs of neuroleptic malignant syndrome, NMS, a life-threatening emergency. Haloperidol must be stopped immediately. Question 7. A newly diagnosed patient with schizophrenia is withdrawn and shows no facial expression. What is the nurse's best approach? A. Give the patient space. B. Engage in short, simple interactions. C. Talk continuously to stimulate response. D. Encourage group participation. Answer: B. Engage in short, simple interactions. Rationale: negative symptoms like flat affect require patience and gentle engagement. Overstimulation or pressuring the patient can increase withdrawal. Question 8. A patient with schizophrenia believes the government has implanted a chip in their brain. This is an example of which type of delusion? A. Somatic. B. Referential. C. Persecutory. D. Grandiose. Answer: C. Persecutory. Rationale: persecutory delusions involve beliefs of being targeted or harmed. Somatic relates to bodily function, referential to unrelated events, and grandiose to exaggerated self-worth. Question 9. Which nursing diagnosis is most appropriate for a patient with active auditory hallucinations? A. Risk for infection. B. Disturbed sensory perception. C. Deficient fluid volume. D. Impaired verbal communication. Answer: B. Disturbed sensory perception. Rationale: hallucinations reflect altered sensory input. This is the most relevant nursing diagnosis in this case. Question 10. A patient refuses medication stating, "I know you're trying to poison me." What is the nurse's best response? A. You have to take your medication. B. That's not true, and you know it. C. I understand you believe that, but the medication is to help you. D. If you don't take it, you'll be restrained. Answer: C. I understand you believe that, but the medication is to help you. Rationale: acknowledging the patient's belief without reinforcing or arguing supports trust. Threats escalate distrust. Question 11. A patient taking risperidone reports breast tenderness and galactorrhea. What is the likely cause? A. Anticholinergic effect. B. Dopamine blockade. C. Serotonin syndrome. D. Allergic reaction. Answer: B. Dopamine blockade. Rationale: risperidone blocks dopamine, which can increase prolactin and cause breast changes. It's not anticholinergic or allergic. Question 12. A patient with schizophrenia is experiencing thought blocking. How should the nurse respond? A. Wait silently for the patient to continue. B. Prompt the patient to hurry up. C. Change the topic. D. Tell the patient they are being rude. Answer: A. Wait silently for the patient to continue. Rationale: thought blocking is a disorganized thought symptom. Silence shows respect and gives the patient time. Question 13. A patient says, "I'm not taking that pill. It controls my thoughts." What is this an example of? A. Magical thinking. B. Thought insertion. C. Flight of ideas. D. Thought withdrawal. Answer: B. Thought insertion. Rationale: thought insertion is the belief that others are placing thoughts into one's mind. It's common in schizophrenia. Question 14. Which intervention is most effective for managing disorganized speech in a patient with schizophrenia? A. Ask the patient to write their thoughts. B. Use clear, concrete language and repeat as needed. C. Use abstract terms to match the patient's style. D. Ignore incoherent speech. Answer: B. Use clear, concrete language and repeat as needed. Rationale: simple and consistent language improves understanding. Abstract language worsens confusion. Question 15. A patient is started on clozapine. What lab value must be monitored weekly? A. Liver enzymes. B. Platelets. C. White blood cell count. D. Potassium level. Answer: C. White blood cell count. Rationale: clozapine can cause agranulocytosis. Monitoring WBCs is mandatory to detect this rare but serious side effect. Question 16. Which statement by a patient suggests effective understanding of schizophrenia? A. I caused this because I sinned. B. I can manage my symptoms with meds and support. C. Once I'm cured, I won't need follow-ups. D. This is punishment from God. Answer: B. I can manage my symptoms with meds and support. Rationale: this statement reflects insight, understanding of chronic illness, and positive attitude toward treatment. Question 17. The nurse sees a patient with schizophrenia suddenly begin rocking and humming. What should the nurse do? A. Physically stop the behavior. B. Ask the patient if they feel anxious. C. Call for sedation. D. Remove the patient from the area. Answer: B. Ask the patient if they feel anxious. Rationale: these behaviors may indicate anxiety or distress. Assessment is the first step. Physical intervention is inappropriate. Question 18. What is the nurse's legal responsibility if a patient with schizophrenia expresses intent to harm someone? A. Keep the threat confidential. B. Restrain the patient immediately. C. Warn the potential victim and notify authorities. D. Ignore the threat unless it's acted upon. Answer: C. Warn the potential victim and notify authorities. Rationale: the Tarasoff ruling mandates duty to warn identifiable victims. This is a legal and ethical responsibility. Question 19. A nurse is educating a patient with schizophrenia about relapse prevention. Which teaching is most important? A. Stop medications once symptoms improve. B. Avoid social interaction. C. Recognize early warning signs of relapse. D. Reduce fluid intake. Answer: C. Recognize early warning signs of relapse. Rationale: teaching patients to identify early symptoms empowers them to seek help promptly and prevent full relapse. Question 20. Which nursing approach is most therapeutic for a patient experiencing paranoid delusions? A. Challenge the delusion. B. Agree with the patient's belief. C. Present reality without arguing. D. Forcefully confront the thought. Answer: C. Present reality without arguing. Rationale: it's essential to acknowledge the patient's feelings while gently presenting facts. Arguing worsens paranoia. Question 21. A patient with schizophrenia says, "The FBI has wired my room." What is the nurse's best initial response? A. That's not true. B. Why do you think that? C. I don't hear any wires buzzing. D. It must be frightening to feel that way. Answer: D. It must be frightening to feel that way. Rationale: acknowledging the patient's feelings builds trust and therapeutic rapport without reinforcing or denying the delusion. Question 22. A nurse notes that a patient with schizophrenia is exhibiting echolalia. What should the nurse do first? A. Ignore the behavior. B. Redirect to a structured activity. C. Ask the patient to stop repeating. D. Provide written instructions instead. Answer: B. Redirect to a structured activity. Rationale: echolalia is repetition of words. Redirecting to activities helps focus attention and minimize the behavior supportively. Question 23. A nurse is preparing discharge teaching for a patient stabilized on antipsychotics. Which statement by the patient requires further teaching? A. I'll take my meds daily even if I feel better. B. I can stop the meds if I start hearing voices again. C. I'll contact the clinic if I miss a dose. D. I understand alcohol can interfere with my medication. Answer: B. I can stop the meds if I start hearing voices again. Rationale: stopping meds can worsen symptoms. Continuous adherence is essential. This answer reveals a misunderstanding. Question 24. What is the priority nursing intervention during an acute psychotic episode? A. Encourage verbalization of delusions. B. Minimize environmental stimuli. C. Begin detailed psychosocial teaching. D. Introduce multiple team members. Answer: B. Minimize environmental stimuli. Rationale: reducing stimuli can prevent sensory overload and agitation, promoting safety during psychosis. Question 25. A patient with schizophrenia begins showing signs of tardive dyskinesia. What is the nurse's immediate action? A. Increase the antipsychotic dose. B. Teach relaxation techniques. C. Notify the provider immediately. D. Administer benztropine. Answer: C. Notify the provider immediately. Rationale: tardive dyskinesia is often irreversible. Early detection and medication adjustment are critical. Benztropine doesn't treat TD. Question 26. A nurse caring for a schizophrenic patient hears them say, "The walls have eyes." What is the most therapeutic response? A. That's ridiculous. B. I don't see any eyes on the wall, but you seem scared. C. You're imagining things. D. You need more medication. Answer. B. I don't see any eyes on the wall, but you seem scared. Rationale. This validates emotion without agreeing with the delusion, promoting trust and grounding in reality. Question 27. Which finding requires priority action in a patient on second-generation antipsychotics? A. Increased thirst and urination. B. Mild tremor. C. Weight gain. D. Drowsiness. Answer. A. Increased thirst and urination. Rationale. These may indicate new-onset diabetes mellitus, a serious metabolic side effect of atypical antipsychotics, like olanzapine or clozapine. Question 28. A patient with schizophrenia is disoriented and refusing care. What is the nurse's next best step? A. Restrain the patient. B. Document the refusal and leave. C. Offer choices to promote autonomy. D. Threaten with consequences. Answer. C. Offer choices to promote autonomy. Rationale. Offering structured choices supports patient control while maintaining care goals, which is therapeutic and ethical. Question 29. What is the best evidence that a patient with schizophrenia is improving? A. Decrease in flat affect. B. Reduction in hallucinations. C. Willingness to attend groups and express emotions. D. Avoidance of social interactions. Answer. C. Willingness to attend groups and express emotions. Rationale. Social engagement and emotional expression reflect real functional improvement and reduce. Question 30. A patient with schizophrenia has been mute for several days. What should the nurse do? A. Force verbal responses. B. Sit silently with the patient. C. Administer an anxiolytic. D. Threaten to call the provider. Answer. B. Sit silently with the patient. Rationale. Presence and nonverbal support are therapeutic and respect the patient's condition. Forcing speech may increase anxiety. Question 31. Which statement by a nursing student requires correction when discussing schizophrenia? A. Patients may need lifelong treatment. B. All patients with schizophrenia are dangerous. C. Hallucinations are a common symptom. D. Medications can manage symptoms. Answer. B. All patients with schizophrenia are dangerous. Rationale. This reflects stigma and is incorrect. Not all patients are violent. Many live peaceful lives with treatment. Question 32. What is the most effective nursing strategy when managing a patient who is suspicious and mistrustful? A. Make frequent physical contact. B. Provide detailed explanations before all care. C. Whisper when near the patient. D. Avoid setting limits. Answer. B. Provide detailed explanations before all care. Rationale. Clear communication reduces mistrust and anxiety. Whispering or surprises may worsen paranoia. Question 33. A schizophrenic patient on clozapine develops a sore throat and fever. What should the nurse do? A. Continue medication and reassess tomorrow. B. Administer an antipyretic. C. Withhold the medication and notify the provider. D. Encourage fluids. Answer. C. Withhold the medication and notify the provider. Rationale. This may indicate agranulocytosis. Immediate action is needed. Clozapine should be held until WBC is confirmed. Question 34. A patient with schizophrenia says, "I'm the president of the world." What type of delusion is this? A. Persecutory. B. Grandiose. C. Nihilistic. D. Erotomanic. Answer. B. Grandiose. Rationale. Grandiose delusions involve inflated self-worth, power, or identity. This belief fits that category. Question 35. A nurse is reviewing the chart of a patient newly prescribed ziprasidone. Which assessment finding requires immediate follow-up? A. QT prolongation on ECG. B. Weight gain. C. Dizziness. D. Insomnia. Answer. A. QT prolongation on ECG. Rationale. Ziprasidone increases QT interval risk, which can lead to fatal arrhythmias. ECG changes must be addressed urgently. Question 36. A family member asks if schizophrenia can be cured. What is the nurse's best response? A. Yes, with medication it goes away completely. B. It's a chronic condition that can be managed with treatment. C. It's best to ask the psychiatrist. D. Don't worry, it won't last forever. Answer. B. It's a chronic condition that can be managed with treatment. Rationale. This gives honest, hopeful education. Schizophrenia is not curable, but it is treatable. Question 37. A patient experiencing psychosis becomes aggressive. What is the nurse's first action? A. Use non-threatening body language and calm voice. B. Physically restrain the patient. C. Administer a sedative without consent. D. Exit the room immediately. Answer. A. Use non-threatening body language and calm voice. Rationale. Verbal de-escalation is the safest and most therapeutic first response before considering restraints or medications. Question 38. A patient with schizophrenia tells the nurse, "I'm being followed by aliens." What is the most appropriate nursing response? A. No one is following you. B. Try to ignore them. C. Tell me more about what you're feeling. D. You're safe, it's not real. Answer. C. Tell me more about what you're feeling. Rationale. This response gathers more information and supports therapeutic communication without challenging the delusion. Question 39. A nurse is planning care for a patient with disorganized schizophrenia. What is the priority goal? A. Encourage independent meal planning. B. Improve communication and reduce confusion. C. Increase academic performance. D. Address long-term employment goals. Answer. B. Improve communication and reduce confusion. Rationale. Disorganized schizophrenia affects thinking and communication. Priority is helping organize thoughts and promote clarity. Question 40. A nurse working with a schizophrenic patient wants to promote medication adherence. What is the most effective strategy? A. Emphasize punishment for noncompliance. B. Use a pill organizer and involve the patient in planning. C. Provide medications without discussion. D. Increase medication dosage. Answer. B. Use a pill organizer and involve the patient in planning. Rationale. Collaborative care and tools like organizers promote autonomy and adherence more effectively than punishment or passivity. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.